We'll talk about two ways of trying to access some things in patients this morning. And this is you trying to test if a patient is able to recognize temperatures, whether the temperatures are low or high, hot or cold, right? So of course you are trying to look at how the nerves of that part of the body are still connected to the central nervous system. Then also 2-point differentiation, 2-point discrimination rather. Okay, this is where maybe you now prick a patient in a particular place, then you ask him to describe where you pricked him. Do you understand? This is also still to access if the nerves at that part are still connected to the brain. So these two tests are mainly for the neurological system, so that's why we're actually even discussing them together. So test for temperature recognitions and 2-point discrimination. Let's go. So for temperature recognition, you are trying to actually look at if a patient is still able to recognize whether a temperature is hot or cold. Do you understand? So you are trying to access the integrity of the spinal thalamic tract in the spinal cord. Okay, trying to also establish that part of the body, is it still connected to the brain and all of that. So you can use 2 test tubes or objects. So of course all of them are filled up with warm water, the other one with cold water. You apply them to the patient's skin. Okay, sometimes you can ask the patient to close their eyes so that warm water can be bringing out steam, so they might know. You understand? So you can ask them to close their eye, just put it on the random part of the body, is it hot or cold, and they tell you what. You understand? So normal response, the patient can correctly tell you which one is hot or cold. Abnormal response, the patient might say some abstract things. All right, that's why you always have to test between the hot and cold. You do it repeatedly. You can do maybe the hot one 3 times, the cold one 2 times, so you get 5 responses. If anyone is wrong, guy, just know that everything is wrong there. Okay, that's the funniest aspect of this. So 2-point discrimination, because the patient can be guessing. You understand? So 2-point discrimination test now, it measures the ability of the patient to be able to perceive 2 separate points that were actually applied simultaneously to the skin. Okay, accessing fine touch and cortical sensory processing. So let me see. I'll put a pin at the back of the patient. I'll put the pin on maybe the back of the back of the patient. Maybe put it on the hand. You ask me, the first pin I put, which side did I put it? The second pin I put, which side did I put it? Do you understand? So you always use 2 pins. Of course, it applies a little bit of pain. I don't know if you understand. So the little bit of pain is what always makes the patient distinguish where you put the thing. So you can use calipers or 2 blunt objects. That's if you don't want pain, you can use a blunt object. Apply them simultaneously to the skin of the patient. Okay, then you gradually decrease the distance between the 2 objects. You'll be changing the points. You put it here, you change, you put it. You always be putting it places that the patient cannot be able to see. Okay, or you tell them to close their eyes. So normal response is if the patient is able to always tell you the places that the object is. Then abnormal response is when the patient is always not able to tell you where the object is. So this one points to a problem in the posterior column medial lemniscus pathway, or the cortical sensory areas. So this one tests spinal thalamic tract, while this one is it is testing the dorsal column medial lemniscus pathways. For all of them is basically neurological examination.